So one of the things we've been discussing is sequencing of agents, because we now have antibodies which are naked or targeted, but we've got bispecifics and we've got CAR-Ts. And we have a few different targets, antigens that they target. And so the question is what order do we put those different molecules in? And from a disease biology perspective, what's the environment like? Are the T cells healthy? When should we be using our T cell directed therapies or our CAR T cells so that we get the maximum benefit out of that? And so one of the discussions is we should be maybe taking them to the first line, because that's when the T cells are most healthy. But also we should be maybe thinking that we don't want to overexhaust our T cells by giving too much stimulation that they no longer work and we lose some of that benefit. The other thing within that mix is that we need to make sure that we don't actually develop resistant mechanisms where we lose the target. So there's some discussion about maybe changing targets and using two different targets, so BCMA and, for instance, GPRC5D, rather than just keeping with a BCMA targeted approach. But also maybe using your CAR-Ts first and then going in later with your bispecifics, so you don't over-exhaust those T cells. So there's a lot of work basically in the lab, but also then as a proof of principle in the clinic that we need to do to make sure that we do this in the right order.